Buonasera, good evening. My name is Natalie Wolderk. I am the National Italian American Foundation's Communications Manager and Assistant Editor. Thank you all for joining us for tonight's webinar, Health Truths During an Age of Misinformation with Dr. John Rosa and Dr. Angelo Falcone. Please be aware that this webinar is about discerning public health information from misinformation. The webinar's content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding any medical condition. So with that, for everyone who's on Zoom tonight, only the panelists will be visible and all attendees are muted and have their chats turned off. During the webinar, please feel free to submit your questions utilizing the Q&A tool at the bottom of your screen. We may not be able to answer your question during the webinar, but Dr. Rosa and Dr. Falcone will do their best to review them afterwards. So without further ado, I would love to introduce NIAF board member, Dr. John Rosa. Dr. Rosa is owner of Accessible Beltway Clinics, comprised of 17 integrative medicine clinics in the DMV, seeing over 60,000 patients per visiting every year, specializing in pain management and lifestyle health. Benvenuto, Dr. Rosa, welcome.
Well, thank you, and hello, buonasera to all who know me, and welcome those for the NIAF webinar that I have not met in the past, and I'm glad you're able to attend. I'm honored tonight to present the Health Truths During an Age of Misinformation, a virtual event brought by the National Italian American Foundation. And for those of you who may not know, NIAF is a membership-based, nonpartisan, non-profit organization founded in 1975. Our mission is to preserve Italian American heritage and culture and promote and inspire positive image and legacy of Italian Americans, and to strengthen and empower the ties between Italy and the United States. Based in Washington, D.C., and we are very excited to host virtual events because we can share information and engage in the Italian American community from all over like never before. It's as a result of the pandemic, which are some of the things we're going to discuss tonight, our traditional sources of revenue and pause and messaging has been hampered, just like many other things in business and life. So if you would consider to become a member of the foundation, to become a member or make donation, you can support our mission. You can visit niaf.org, NIAF.org. And I'd like to personally thank you tonight for spending the time to take time out of your evening to spend with us. For the first 15 minutes, what we're going to do is I'll have Dr. Angelo Falcone speak about COVID-19 current statistics, testing, treatment, vaccines, frontline experience. Then the following 15 minutes, I will jump in and talk about some of the prevention methods, maybe some overall health issues that we see, the other pandemics that we look at, which is just lifestyle issues that become more susceptible, and some mental health issues that are going to result with current and future issues. So the last 15 minutes we'll do question and answer. So we'll be monitoring the chats and we'll be getting those questions as we're speaking so that we could take the ones that we feel may be covering the bases and most relevant. But please feel free to reach out afterwards, either to NIAF, through NIAF, or even visiting my webpage, drjohnrosa.com. You can put in comments or reach out there to have any further questions that you may have. And with that, I'd like to introduce my co-sponsor, who's a colleague and a dear friend, Dr. Falcone. I mean, in my intro, they're talking about 60,000 patient visits that we see through our integrative medicine practices in the Metro DC DMV area. But my friend, Dr. Falcone's, the number of visits are upwards and above of 6 million a year. So I think he's got a little bit more experience on that front line side of what we're seeing and what we're feeling and what we're having. So with that, I'd like to pass it over to him to start the first section of our webinar.
Well, thanks, John, and thank you to NIAF for this opportunity and for everybody tuning in. Appreciate being able to get out accurate information. As John said, I'm a physician, trained as an emergency physician, practiced for 25 years at the bedside for patients, mostly in the DC area. And my organization, of which I'm a board member, actually treats 6 million patients a year in the front lines in the emergency departments across this country. 1 out of every 25 patients seen in an ER in the United States is seen by one of my partners. So it is a large frontline organization, and we've been there from the beginning, and we will be through this pandemic and whatever comes in the future. And I think we've learned a lot over the last 6 months. And what I wanted to talk about is really hit on 3 specific areas. Really, what do we know about the virus today that we didn't know 6 months ago? How is it really affecting your body? And what are some of the things that we can do treatment-wise to actually lessen the impact of that? And certainly my good friend, Dr. Rosa, will talk about the prevention and some of the things that you can do to keep yourself healthy. So let me step back for a minute and let's talk about statistics, because I think we have to appreciate those statistics. Over 19 million people worldwide are affected by COVID-19, which is the infection caused by the coronavirus. You know, there's been over 700,000 deaths worldwide. And when you look at countries around the world, the United States is the 3rd largest country. Unfortunately, we're number 1 in 2 statistics we don't want to be number 1 in, and that is the number of cases, which is over 5 million or approaching 5 million, and unfortunately, the number of deaths, which is 150,000. To give some perspective, the next country in line would be Brazil, the 5th largest country in the world, with 3 million cases and 100,000 deaths. And in comparison to Italy, which obviously suffered the brunt of a lot of the pandemic early on with China in the northern region, they had 35,000 deaths and close to 250,000 cases. And they've been very successful at flattening the curve. So those are big numbers. So what do we do with that information? Well, one of the things is we find out how the virus acts. So if you look at COVID-19, coronavirus, what we realize is that for every 1,000 people that get infected, about 6 to 7 will succumb to the illness and die. And that we know from studies across multiple countries. So that's important information. So what do we do with that information? So we're going to move to testing, which is an important component of testing for 2 reasons. Number 1, do I, Angelo Falcone, have the virus? And number 2, what's going on in the population and what's the community spread of the virus? So we're doing a lot of testing now in many countries to try and determine exactly what that is. So why is that important? Well, coronavirus spreads through usually respiratory spread. And droplets and aerosol, and we're not going to go into a lot of details about that. But if I develop COVID-19, if I develop an infection, I will likely infect 2 or 3 other people. That's just what the statistics show. It'll take any individual about 5 to 6 days to show signs of the illness, usually runny nose, dry cough, fevers, body aches. Those are the early signs of the infection. That happens at 5 to 6 days. Unfortunately, you can start shedding the virus from your nose and from your throat at 2 to 3 days. So for example, if I picked up the virus today and I start passing it along to people and there was no barrier protection, no masks, over the course of 30 days, I could be linked to up to 4,000 cases of COVID-19. That's a pretty big number. One individual transmitting it every 2 to 3 days, those individuals transmitting every 2 to 3 days could cause 4,000 cases of it. So that's one of the reasons that we're doing a lot of testing and trying to track this information. So what happens when it gets in your body? As we said, it starts in the nose, starts in the throat, and then of course it works its way down into the lungs, where it causes the most damage because of particular receptors that are in your lungs. Those same receptors we're finding out are actually on the surface of some of your heart muscles, and we're seeing some cardiac damage directly from the virus. We're also finding out that COVID-19 can actually have an increased chance of causing clotting in the body. And that's something relatively new over the last several months that we're learning that we didn't know before. And finally, there is some impact on the brain, whether it's due to the virus directly impacting the brain or whether part of the inflammatory response of your body or a combination of two, we're still sorting out. So those are the major ways it can affect your body. The good news is 80% of people, 8 out of 10, will have a very mild case. 20% unfortunately will get sicker, may need to be hospitalized, may need to be put into an intensive care unit. So one of the questions that we'd like to answer is, who do we need to worry about? Who are the people that are likely to get sick or at higher risk of getting sick? So there's two ways to look at that. One, you can look at it from an age standpoint, how old you are. And the other way you can look at it is your health conditions, your general health, some of the diseases that you may or may not have. So let's talk a little bit about those age requirements. If you're under 60 years old, you can kind of draw a line. And remember that number we talked about, 6 to 7 people per 1,000 will die from this disease if they get infected. If you're under 60 years old, that number actually stays in the thousands, 6 per 1,000, 5 per 1,000, 4 per 1,000. And we know that very young people do not get a serious case of this disease. So that's the good news. Unfortunately, as you get older into your 60s, we start talking about the mortality or the deaths per 100. So in your 60s, 2 to 4% of people, 2 to 4 people out of 100 will die. Up until your 80s, 15 out of 100. So dramatically higher as we age. Has to do with the immune system and how effectively you can fight off an infection. And as we know, as we get older, typically people develop more health issues. So what are those health issues? So the ones that we know will cause an increased risk in people that contract coronavirus. Chronic kidney disease, people with kidney disease, we know are at increased risk. We know that people with chronic lung disease, not surprisingly, since that's one of the major areas where the virus affects. People that are obese and have obesity. Being obese means you have increased inflammation in your body in general. And what we're finding is that more inflammation in this particular situation with this virus is not a good thing. So people that are immunocompromised, folks that are under treatment for cancer, chemotherapy, suppressing your immune system, and other diseases like that. Certainly diabetes we need to worry about. So what about cardiac disease? We know that people with heart disease are at increased risk, but it's not just people that have high blood pressure or high cholesterol. It's more serious conditions of heart disease, multiple heart attacks, stents in place, congestive heart failure. So not just your run of the mill, I have a little bit of high blood pressure, do I really need to worry about this? So when you overlap your age and your number of medical conditions, that's when your risks really start to rise. So what happens when patients come in and need to be treated? Again, remember, 80% of us get a mild case of the disease. We'll stay at home, we'll self-isolate, we'll do all the things that your grandma talked to you about, take your chicken soup and be well. If you come into the hospital, there are several things that we can do today that we couldn't do in the past. One is we know that a medicine called dexamethasone, which is a steroid medicine, very commonly used in people with lung disease, can actually reduce the inflammatory response in your body and make it a little less likely for the disease to progress. Similarly, a drug called remdesivir, which is an antiviral medicine, it actually prevents the virus from replicating in your body, has shown effects. Now, these are not wonder drugs. They don't suddenly make you well and you're able to walk out of the hospital, but they lessen your chance of the disease progressing to the more serious conditions. And one of the things we found out, interestingly enough, over the last 6 months is that we were very quick to put people on ventilators with all of the publicity about ventilators. We're finding the longer we can wait to put people on ventilators, maybe give those other medicines a chance to work, the better off patients are. Because once you're on a ventilator, your risk of mortality or dying from the disease dramatically improves or dramatically increases. So that's on the medical side of what we can do. long term, I think what we need to talk about is the vaccines. And to give you some perspective, the fastest a vaccine was ever developed for a virus was in the 60s for the mumps vaccine, which took 5 years. Now, this is a disease that just showed itself really in January of this year. We're not even 8 full months into this pandemic. And already there's over 100 vaccines being tested. There's 10 in what are called phase 3 trials, which means they're being tested on tens of thousands of patients. It's past their safety, the safety trials, and they're looking at how do we get it out to the public. So I think this is an area where we can be very proud of what the work the governments have done and the works that the pharmaceutical companies have done to try and get vaccines out there. There's a hope that maybe we'll have the beginnings of a vaccine by the end of the year, but most experts are saying that it's probably going to be another year before we get the vaccine, it gets manufactured, it gets distributed, and it gets into everyone's hands that needs to have that. So the hope is at some point we'll develop what's called herd immunity, which is when a certain percentage of the population are either vaccinated or have been infected by COVID-19, and they develop natural immunity to that. Nobody's really sure what that number is, but there's somewhere around 60% of the population or more. So that's a lot of people that we got to get a lot of the vaccine to, because most of it's not going to be through infections. And the lingering question we have is how long do those antibodies last, whether through vaccination or through natural immunity, being infected by the virus and surviving. And that's just a question we don't know. We'll know a lot more about it in 6 months than we do know today, but it is very likely that we will probably need to have recurrent booster shots of this to be able to keep your immune system from fighting the infection. So that was really a kind of whirlwind tour through a lot of the medical side of it. What I want to really stress to you is there are ways to protect yourselves. Use a mask, use your physical distancing, wash your hands a lot, and that will keep you as safe as possible. So at this point, I want to turn it back over to my good friend and colleague, Dr. John Rosa, to talk a little bit more about those issues.
Thank you, Angelo. If I could, it's very difficult if those who know me to speak for 15 minutes about any topic. I think you'll understand is extremely difficult. But what I'm going to do is we're going to talk about the current state of affairs in population health. Now, Angelo said some of those more susceptible people, and I want to kind of do an overview of what susceptibility means and the reason why we're not hearing about that. There's a term called evidence-based in medicine, and it's used all the time, and we don't like to see this in the media or government officials trying to put information out that doesn't tie the evidence to a specific disease or a specific problem. So there's a ton of information out there that we know already works to keep our immune system functioning. What we can do for ourselves and our loved ones to have control over this. This process we're going through, the worst of it is the fear of an unknown, an invisible enemy that pops into the system. And because you don't know and don't see, you feel like you have no control. Fear really is that feeling of not being able to handle something that's going to harm you. And that, I think, is really what's widespread in society. But if we look at a population health and the things that cause this inflammation, Angelo had spoken of. So chronic inflammation comes with things like obesity. It's funny. I'll give you an example of what it means to be the pump primed for you to be ill. So what can we do? I'll tell you what primes that pump, and then it'll obviously be what you can use to help. So it's something called inflammaging. I mean, aging is something Angelo spoke of, and inflammation is the key to almost all ailments and things that we can do that put a systemic level of inflammation. Usually inflammation, we understand, you twist your ankle and it blows up like a balloon. We understand that that's inflammation from an injury. But we get systemic inflammation in our system from all the bad things that can occur. and it sets you at a different place. So if inflammaging, it's called, as we get older, we have a low-grade systemic inflammation. That's what we do blood tests, and we get C-reactive protein and other markers that we can look at. Then we can add in things that sedentary lifestyle, no activity, bad diet, eating. So we Americans have 60% of their diet are coming from sugars, refined sugars, and processed foods. 60%. All those things cause inflammation. So let's pretend our normal health state is a pilot light on the stove. So our age will turn that stove on to a low burn. Obesity, being overweight, the leptin hormone, the proteins that get produced from being overweight will actually cause inflammation. There's these proteins like interleukin 6 and the rest that come out will cause that flame to get turned up a little bit. Mental and emotional stressors. Who is not under extra stress? Who is not and worried about an elderly person, your own family? What are you going to do? Financial decisions, things that are going on in society. Worried about the homeland if you're Italian American and tuned into this because they went through such a bad. I mean, the stressors are through the roof. Those also produce things these proteins that cause inflammation. They're called cytokines, by the way, and I'll get back to why that's important. We also have, between the diet, smoking will increase it. Sleep. If you get less than 7-8 hours of sleep, the markers show that pro-inflammatory markers and what it does to your immune system is so drastic, and it's studied beyond studied. Just because sleep is not studied with COVID-19 yet, it's actually going to be put into things as we go forward, but we know plenty about the markers in the immune system when we don't get enough sleep. Sun avoidance. When you're stuck at home and we're not going out, and when you do go out, you're either fully clothed or lathered up in some sort of sunscreen, vitamin D is beyond critical and crucial to keep a balanced immune system. But without doing that, the vitamin D, what it does is balances your ability for these cytokines, pro-inflammatory cytokines and anti-inflammatory cytokines get balanced so that you're constantly have a normal range as opposed to having too much inflammation. So that flame on the stove with all these things I'm adding, we're just ticking it up slightly, and eventually what happens when COVID knocks on your door, if you're set with these pre-inflammatory markers, it's almost like just telling them it knocks on your door, you don't even get off your couch because you got 3 bags of potato chips and ice cream and you're watching TV and you haven't moved in 2 weeks, and you don't even get up to answer the door, you just say, come on in. And that virus will walk through the door and say hello. But if you're doing the right things, you don't have underlying disease. Your age is not even the age as a factor when you're eating right, exercising, monitoring the system that your intake of vitamin D. You can take that. It doesn't have to just be from the sun. We can take supplementation to get a boost of our immune system. I'm going to back that up. I don't like boosting the immune system. You hear it all the time. What can I do to boost my immune system? What I just said was that pump being primed is your immune system. So when you're obese, when you don't eat right, when you don't sleep, when you have mental issues like the anxiety and depression that come along with this, it's raising your cytokine level to cause inflammation in your system. So to boost your immune system would actually boost that cytokine. In fact, the ultimate boost is when you have COVID and it hits your lung tissue and you're already inflamed and you get what's called the cytokine storm. And the cytokine storm is the uncontrollable amount of inflammation that your immune system is trying to do its job. And its job is to fight obesity, to fight this terrible diet you have, to fight the fact that you're not moving, to fight the fact that you're elderly, to fight the fact and then all of a sudden you throw in this virus and the amount of proteins, bad proteins, the cytokines that get produced, it alerts your immune system to be on fire, and it just shows up, and it shows up fast and furious, and you get a cytokine storm. That's what makes people pass from this disease. So it can be inevitable, and sometimes when the viral load is very, very high and you get such a bad infection from this. But what I want to do is unravel your preloaded system. So do your best to eat properly. Make sure that you move. You have to move. You can't get the stressors. There's techniques that we can do with mindfulness and meditation, and sometimes people are like, oh, meditation. Download one of the apps and see how it makes you feel. It's incredible. There are so many like little pieces that you can do, and you can Google things that'll help for sleep. Melatonin is one. Melatonin is actually one of the things that regulate the immune system, and you make it when you sleep. And it's also a very popular supplement to take to help aid you to go to sleep. It's actually the supplement that will help you fall asleep, not stay asleep. But it's also a critical, there's a lot of research going on with melatonin and the immune system. Not as much as vitamin D, but vitamin D is very crucial. I just want to hit on it really strong though, because there's so much research out there and that states and cumulatively state that it will reduce the level of lung infections by 40% if your vitamin D levels are normal. The information that came out of Italy and some of Europe, the countries in Europe, along with now with the United States, is there's somewhere between 68 to 80%, depending on the study, of the people who are hospitalized or had to be put on ventilators or passed had below normal levels of vitamin D in their system. Now, between lack of sunlight, food doesn't contain it, it's actually a hormone. It turns into, it's not just a vitamin, it actually turns into an immunomodulatory hormone. And what that means is it's responsible to modulate your immune responses. And it prevents that. It'll actually help prevent the massive immune response because it regulates it. So we don't get that cytokine storm, which causes severe infection or death. Now, 42% of the United States population is deficient in vitamin D. Now, that's a pandemic within itself. 75% of the US population is overweight, with 42% of that population being obese. So the numbers are higher in this country, like Angelo said, the number of deaths and the number of cases. But we really need to take a good look in the mirror for ourselves and our families and the people we love, and take a deeper look at what is our pandemic already? What is our epidemic in this country of very low, insufficient diets with the proper nutrients, and the fact that we're 75% overweight as a country, 42% obese. 82% of blacks have a deficiency in vitamin D. The color of the skin, the melatonin in the skin, does not allow the absorption of the sun. The sun turns cholesterol in your system into vitamin D. That's how that process works. So because the darker skin, blacks are 82% deficient in vitamin D. 42% as a population in the US, 70% Hispanics. But my Italian American friends that I know and love, and my family and some that I grew up with, we do have fair skin, kind of like the light shining off my head today and my blue eyes. But a lot of people are darker skinned there as well. And that's a problem when you're not out and about absorbing. The elderly population is not out and about absorbing sun. They never take a supplement for vitamin D. So we really have to have a look at that. And there's levels, and you can look at what the recommended, it's 400 I use from the way that the CDC and the rest recommend. And 400 is absolute joke. It's for children, it's 4,000 international units a day. And the upper limits for an adult is 10,000 international units a day. And when I say upper limits, when you get this tested by the doctors, have been testing this a lot of late, and they'll give you your results, and in order to get to like 60 nanomoles per milliliter, 150 nanomoles per liter, there's on the test you get done, it shows that normal range. The range is so different from what you need to take individually, especially if you're obese, because D is a fat soluble vitamin. It will be absorbed by the fat before it goes into the bloodstream. So there's this balance of somebody who could take 1,000 international units a day and have a real good level. Someone else may need to be 5, someone else may need to be 10, but you got to make sure we understand what that looks like. Exercise is obvious because it fights obesity, it quelches type 2 diabetes, it helps with the sugar, but it also, there's studies that show that just with a moderate level of activity and exercise daily, the T cell activity spikes a lot. And that T cell is your killer T cells. Those are your immune system that go and fight things when it enters your system. Also exercise, the lymph system your lymphatic system, your immune system doesn't have a heart. It doesn't have a muscle that pumps through and sends, like, blood gets brought back to the lungs and shipped out to the muscles. The heart's doing its job and contracting all day. The lymph system is just, there's something called bed sore, and Angelo can contribute to that in the hospital system. When you don't move and you're in one position, you develop a sore because the tissue just degrades because the lymph system isn't going in there to help fight any bacteria or other infection that may be there. So your lymph system actually goes in by contracting and moving your muscles. It moves the system through. So you got to keep moving. Sleep as well, we discussed. Stress, I hate the word social distancing. We should never be social distancing, ever. Physical distancing, fine. We understand we have to have some distance, but social, you should never socially distance from anyone, especially your loved ones and your family. The social part of things, like we are doing absolutely right now, is critical. So we want to keep that in for mental health. Pick up the phone, call your friends, call your parents, call your family, anyone that you know may have be able to get that call. Lifestyle changes, smoking, drinking too long, risk taking, not wearing a mask, being in public, going to an amusement park. I wink at that because I just went, and I know here I am lecturing on things you should not do. And dehydration is another king. We've got to make sure that, especially in the elderly population, they do not drink. Especially when they travel, they don't want to stop 100 times. But dehydration will plummet your immune system as well. So I gave a bunch of things. I hope you can jot them down and go back and read through or review this again. But I think it's critical that we speak of the things we have control over. We can definitely make ourselves not invitable for that thing, and that storm wouldn't hit because our pumps aren't primed. So keep yourself healthy, happy, and make sure that Sunday dinner you sit around, nothing better than sharing a meal and having conversation with your family to jack up your immune system. So with that being said, I'll move over to any questions that we have gotten and a few that we can say that are pertinent and pertinent. Hey, there's Angelo.
Great. Well, thank you both so much. It's been so eye-opening and just nice to have both of you have this fireside chat with us. I know there's so much information flying around, and just nice to hear from both of you in a very comprehensive, holistic way. So with that, we have a few questions. The first one is, can you explain the pros and cons of using a mask, and are they useful or not?
Angelo, I'll let you start that one.
Sure. It's interesting that somehow mask wearing has become a political issue, which I'm not quite sure how that happened, where the science is pretty clear on it. And I can talk about some of the specifics of that, but I think the best way to really describe it is two examples that we know. And those two examples are actual cases that were published in the medical literature. The first one comes out of Mount Vernon, Washington, and you may have heard about the choir, where one individual was infected with COVID-19. It was early in the infection, wasn't really showing symptoms, but then subsequently tested positive soon after he had choir practice. This was a 2-hour choir practice with 60 people in a relatively restricted area. And after that, 52 out of the 60 people, and they weren't social distancing, it was before masks were widely used. And just due to the singing and choir practice, 52 out of 60 people acquired an infection because of that. And unfortunately, 2 of the members of the choir actually succumbed to the disease. So that's on the one extreme. On the other extreme is a case that was an observation that was published out of Missouri when they had just implemented mask requirements for their state or for this particular area. And this made national news. Some of you heard about the hairstylist that had coronavirus and continued to work. Now, they were wearing masks and their clients were wearing masks. And these 2 particular hairstylists had 160 encounters with individuals who were contact traced, tested, and a total of 0 developed the infection. Again, pretty strong evidence. If you've had your hair cut, it's not like you're really social distancing from your hairstylist. So to say that out of 160 people, none of them developed the infection is a pretty powerful statement on masks.
Yeah. 100%. I mean, not only is the literature there, and especially those two examples, Angelo, are spot on, just to say that you absolutely should. Now, to give some perspective of, I like to talk about viral load, and Angelo and I have had this conversation before. So viral load, when you're talking about the things that they ask you to do outside of all the stuff I did on prevention, now we're talking about the washing of the hands. Why? Well, the virus could be there, and you don't want to touch your eyes, lips, nose, and face because the viral load may be there. Washing your hands, then you have masks and the distancing. So if viral load, how do I explain this that could be a little easier? So if it's pouring rain outside and you step out for 1 second and come back in, you're soaking wet. That would be getting coughed or sneezed upon directly into your face, or touching a surface that had it and you went to your lips and mouth, or conversing or being in a room with someone who's sick who doesn't have any sort of covering. And then there's times you go outside and it's barely drizzling, and you can go out for 10, 15, 20 minutes and come in and not really be wet. That's what I mean by the viral load. So wearing a mask, I mean, when the studies and the things that we see, when you have a cloth mask, there's variations of the type of mask and how much they do. The clinical setting, it really protects anything from coming out or going in. The cloth masks have their triple layers. It's important. Then there's the paper mask, surgical mask. They all have some level of not allowing the droplets to escape or come in. Now, are they completely 100% protective? I mean, absolutely not. I don't know of any study that says they are. Even the ones that you guys use in the medical setting, right, Angelo? I mean, they're not.
Correct.
They're not 100%. I mean, that's why they're called N95 or 99s. It's like you get to a high level, but all of those things are saying if you're not pushing out enough droplets, so the mask really, on the higher end, the mask protects somebody who may be sick from pushing the droplets out to others, and the one who actually wears it has some level of protection. Even though it can squeeze and move around, I would rather be covered than not covered. So I think it kind of gives a perspective of what that viral load looks like. And you could be out and about and in a crowd and someone's sick, but you walked by them and you're moving around, there are things in the air, but you have 3 levels of an immune system. You have a barrier immune system, which is your skin and your nostrils, the cilia, these hairy things in your lungs that push stuff out. And if you're only getting some of this load, it's not going to infect you. But the more viral load that's there because you're not doing the wise things to protect yourself, obviously you have a higher percentage rate of being able to get infected, and that the level of the infection because you're taking a higher load in. So masks are critical. Is there a next question?
All right, thank you. The next question is, some media point fingers at beachgoers and say protesters are not a cause of spread, while others blame protesters and while people who are also trying to go back to normal. What's the truth?
I'll take this one first because it gets under my goat. I'm glad that was actually brought up and asked, because politics have nothing to do with this. If you're protesting and you're screaming at somebody with no mask on and you're infected, what I just finished saying, it's so obvious that you're going to be able to infect and affect a lot. So that's not okay. And going to the people that are going to beach or bars and in crowds, and the younger people of our population that thought, initially, if they're not getting sick, it was a bad message. You're saying, it doesn't affect the young, and they're thinking they're invincible, and they're going to do the same. This finger pointing's terrible. It only leads to all the things I said before: stress, anxiety, anger, point of finger. That raises your inflammation. You ran to the stove and you turned it up. So don't go there. Just understand how this works and be very cautious. I don't think there's finger pointing that should be on anything with this. Angelo, I'm sure.
Yeah, I think, I think it gets to the heart of the issue. Where is it safe? And certainly being outdoors is better than being indoors. We know that. Probably the worst place you can be is, I saw a study recently, like the bars are probably the worst place you can be, because you usually spend a lot of time sitting at a bar next to someone who's probably having a drink, which then leads to decisions that you probably shouldn't be making at that point. So I would spend as much time outside as you can and really avoid in closed internal spaces as much as possible. I mean, it's been a message that's been put out there, and county governments and state governments are trying to balance, you know, what's right reopening, what percentage of restaurants should be open or shouldn't be open. A lot of the information we simply don't know, and we're continuing to learn as we go. So better to be outside than inside, pretty clear on that. But if you're going to be in a close quarters with folks, even if you're outside, you should have a mask on.
Okay.
Question?
Yes, the next question is, what are the long-term health issues for those who got sick and even those who didn't?
Sure. I'll jump on that one, John. So it's interesting. Remember, we talked about the 80% of patients or people that get infected have a mild case of the disease. Obviously, we talked about people that were in the hospital that, you know, have serious problems, serious impact on their lungs, other things that are going to happen. But even for the people that have mild disease, they're finding that a third of patients that did not require hospitalization 3 weeks out are still having symptoms. Now that's not your common cold. If you're 3 weeks out from a viral infection and you're still having symptoms, that's preventing you from going back to work or preventing you from really doing your normal activities. That's a fairly serious impact. And even in younger patients, less than 35 years old, they're saying that 20% or 1 out of 5, 3 weeks later, are still having pretty significant symptoms. So it just goes to show you that this is not your run-of-the-mill virus that we're dealing with. It is could be a very serious infection. And, you know, there's obviously people that have been hospitalized that it takes 6 to 8 weeks for them to recover once they're discharged and they're home. And that's just not what we normally see with typical viral infections. And I will say, when we think about the flu that's upcoming or soon to be coming, the hope is that all the data that we're looking at is showing you should get your flu shot, number one. And number two, that we're likely to have a mild flu season just because people are following the things that prevent COVID from happening. So hopefully we'll also keep the incidence of flu pretty significantly down. So.
Yeah, I totally agree. And I think even some of the information out of Australia recently, because we follow them, usually they go through their flu season and then we try to see what our vaccine and how things and the percentage may look like. And theirs is the lowest, I think, on record.
Yep.
It's because they've been following all the typical things we talked about, and the mask and the hand washing and the distancing. So that's a blessing. Hopefully that happens. But so the mental health part of the question, I guess, you know, it's the question on what are the long-term effects of those who are sick. I think Angelo did well touching on each piece of those, but the ones who don't, I mean, we have a whole nother epidemic that's going to occur in mental health because it's hard. I mean, I'm still seeing patients all the time, and I find it so difficult not seeing the rest of their face and the expressions. And when I'm trying to ask certain questions, or then children there's neuroplasticity, the way our brain develops, they set these little roads and pathways that they remember so that when a trigger happens, they follow that same pathway because it was given to them. It's like a rut in the road. When you're driving on it enough, then you get these ruts that form in the road so that everything can follow that path. And I'm really worried that we're getting this false feeling of community, and then the scare of not knowing, and then going back to school, not going back to school. And they're telling me I'm young, I'm okay, but I'll bring it back and I'm going to kill my nonna. That's grandmother and grandfather for those who don't know. So, I mean, it's just that part of, and we see in mental health, now I'm an expert in the opioid crisis, so mental health is like a massively intertwined in that, and I lecture all over the country on it. We have seen a jump in opioid overdose by, it's 20, 30-fold. They're saying an extra 75,000 deaths can occur this year in overdoses, where we only get 60-something year to year. So it could more than double. And that's scary to me, because that part of the mental health side of the thing is something we haven't unmasked yet. So I'm nervous about that. Yeah, and I see that there is a couple of follow-up questions. I saw one that I just want to comment on that said that my doctor told me that wine was inflammatory and that I should stop. Is it okay to have pasta and wine? Oh boy, what I was saying earlier about making the mental status of your being happy. Wine has such a high level of antioxidants in it that unless you're putting down a bottle or two, which I've been known to do, I wouldn't advise it. But if you're going to have a glass, even or two with dinner, absolutely not. So I saw that on a question. I don't know if there's any follow-up. I think we may be hitting our time, which is disappointing because we can go 2 more hours on this topic.
Yeah, I mean, there are some questions that you've already answered and covered with just this Q&A session too. I don't know if this is something that you will be able to answer, but Miriam asked, so can we say that people who get the virus but have no symptoms, do those people have a low viral load, or do we think it's something else?
So I can certainly comment, and John will jump in. I think, you know, as John said, it does depend on how much of the initial virus that you get, whether you mount an immune response or how strong that immune response is. So if you're standing next to someone and the example is they cough on you and you get a lot of viral particles, you're going to get a large viral load. Whereas if you're in a closed space with somebody and you just happen to be in an area, you may get what's called a subclinical infection, where you just get a little bit of your immune system teased, but it doesn't fully activate. There's a lot of questions about, can you get reinfected with coronavirus? That's very controversial, and I think it does speak to what was the initial infection like. Clearly, if you developed antibodies, as your body will do to any infection, and you have evidence of antibodies, the likelihood of getting a second infection is, in a short period of time, is almost zero. If you had a small viral load and you had a nasal swab and it was positive, but your immune system never got triggered, you may not have just had enough of a push to really have your immune system respond to that. So we're learning more and more as we go on with this particular disease, though.
Yeah, and I'll reiterate too what I said earlier. We're talking about viral load, but we're also talking about what is the condition of the person who receives the load. So if you're already compromised, immunocompromised, or obese plus type 2 diabetes with high blood pressure, then you may not need as much because your first line defense is already compromised. Your immune system is so spread out fighting all those things. It's like Germany did not lose World War II because they weren't strong enough. They took over so many places and said, wow, this is easy, let's just keep going, until a couple of countries came in and said, well, we're now going to overpower them. And they were so spread out that it took over and took them all over 100%. So yeah, you don't want your immune system scattered all over the place, because then the amount that you're going to see is less. One takeaway from all this is, please, everyone you're with or see or pass by, pretend they have it.
Yep.
Because if you think they do, you're going to feel and look and protect yourself in a different way than being lackadaisical. I think that may be just a good way to end some of the advice. I know our time's running. Any other questions from the moderator we have, or should we stop here?
I think now is a great stopping point. We'll try to review any of the remaining questions after this, but we want to thank you for submitting them. And Dr. Rosa, I don't know if you want to just close it out for us.
Yeah, on behalf of the National Italian American Foundation, I want to just thank everybody for taking the time out of their evening. It's important information, and again, it's trying to decipher what social media, Twitter and Facebook are not the places that you want to get your information. And then when you say, well, that's kind of confusing and it's biased, let's go to the regular media outlets. Well, guess what? They're very biased as well. So you just start pulling your hair out thinking, where am I supposed to get it? And Dr. Google is also not the smartest doctor in the room. So if we could do this and maybe just do it again on a catch-up in a month or two, if there's a reason for it, I think Angelo and myself would be more than happy to keep everybody abreast. So thanks for taking the time out. Thanks for being interested in the National Italian American Foundation. I sit on that board. I'm so proud to be on it. The people that we have on our team are great. And I just thank you very much, and grazie mille e buona serata.